Okay, so good afternoon, everyone. I'm so pleased to see there's a few familiar faces in the audience, which is absolutely brilliant. It's really reassuring for me. And I'm so appreciating you coming here today because I understand that it's your lunch hour and it's your time. And the fact that you've come here this afternoon says a lot. It says a lot about actually how you feel about your health, which is really important. And congratulations, because the evidence shows that most men they normally wait until they've had a health scare until they do anything about their health. So you've done really well. You're ahead of the game, which is brilliant. So this session's going to last maybe about 45 minutes to an hour. I'm going to tell you a little bit about what I do, who I am, how this club's going to work, and why I've chosen to talk about men's health. I'll tell you a little bit about sort of my philosophy, which is the six pillars of lifestyle medicine, and one of the pillar we're going to talk about this month actually is nutrition, and we're going to talk about, in particular, we're going to talk about obesity. And then I've got a very special guest who's going to talk about his experience of living with obesity all of his life. And then you can ask me any questions. I've got a few questions that have already been sent to me, so we can go through those. So, okay, so a little bit about sorry, hold on. So a little bit about me. So I'm Lisa Clift. I'm a GP. I'm also a lifestyle doctor. I'm also have a special interest in obesity medicine and men's health. And I've trained in transformational lifestyle coaching. So what I do is I basically help men transform their health. And I take them from a place where they may have felt out of control with their health. They might not know where their health is right now. So or they might have recently been diagnosed with type 2 diabetes, or they may have been diagnosed with high blood pressure, or they may have been they've got high cholesterol, and they want to look at all the options. They want to see, do I have to take these tablets, or are there things that I can do to try and reverse this? Or they might have been dealing with anxiety or depression, or they may even be feeling like, I don't care if I don't wake up tomorrow. And that's something I've heard a lot of men say. So what I do is I try and help them transform from feeling like that to feeling more in control of their health, getting their energy back, feeling back to normal, feeling more in control and feeling like their old selves. And the way I tend to do that is I tend to bring I do a thorough assessment, men's MOT assessment, where I take full history and do an assessment, do some bloods, any further investigations that we think might be needed. And once we know where someone's at, we can then look at what we can do about changing it. And I have the transformational programs that I tend to use with my patients, and that's looking at changing lifestyle to then make improvements in health. And I've got to be honest with you, I do talk about 12-week packages of transformational, programs, but actually sometimes if you're going to change your lifestyle, it can often take longer than 12 weeks. It could sometimes take 12 weeks to embed one particular habit. So, what we do is we tend to package them into 12 weeks, reevaluate at the end of 12 weeks, and then see, well, what do we want to do? Do we want to have another 12 weeks, or just carry on week to week and see how things go? So this isn't about what you look like. This is about your health. And it's not something that you can change overnight. So just to tell you a bit about what I do in my professional life. So I work both in the NHS and privately. I work 2.5 days as an NHS doctor, and I work in a men's prison in Manchester. And I do that half of the week, and the other week I tend to work on my business, see patients in my clinic. I can either see them face to face or virtually. My clinic's based in Manchester, so people are very welcome to come there, or I can see people virtually via video consultation. Okay, so why men's health? Well, two reasons. One is I work in a men's prison, so I work with men every day. I've been working in a I've been a doctor for 30 years, but in the last 10 years I've been working with men in a prison environment. And so I'm used to listening to the sorts of problems that men have. I'm used to talking to them. Um, and the glaring thing with this is what's a woman doing sitting here in a in a room full of men? But it's something that I'm used to. Some men don't particularly like talking to women, but what I've found more often is that men actually do like speaking to women because they find that they can possibly be a bit more open. Um, they're not embarrassed. They don't have to have there's no bravado. They don't have to be brave. They can just, say it as it is. And to be honest, having worked in a prison, I can pretty much say I think I've probably seen and heard most things. And I'm used to working with men who are at rock bottom. And, um, that, yeah, it's not anything that phases me. Let's put it that way. Okay, so that's why I do men's health. But also because there is a massive need for it. So you guys, you're our husbands, our brothers, our dads, our uncles, our cousins, work colleagues, friends. We need you in good health. And the numbers for men are not good, which is really upsetting. Basically, the picture is this. So someone who's born in, say, a boy who was born in 2021, their life expectancy is until the age of 78. A girl who's born in 2021, her life expectancy is 82. So women on average are generally going to be living longer, at least 4 years longer than a man. 36% of men will die before the age of 75. And the sad thing is that a lot of the causes for premature death are reversible. They're preventable. So the top five causes of death in a man are heart disease, dementia or Alzheimer's, lung cancer, chronic lung disease, and a stroke. So all the risk factors for these conditions are things that you can improve, you can prevent. But it's not just about what age you die. It's basically about how many years of good health you have. What are your health years? Because at the moment, for a man, their average number of health years are 61 years. So I think it's really sad that for the other 17 years, men are living in poor health. And that's not what anyone wants. You want to be living a long life and you want to be living a healthy life. So this is my contribution towards this. I want to raise awareness um, of the importance of having good health for men. Um, what I want to do also is I want to give you as much value as possible. I want this to be something you feel is like a good use of your time. I want it to fit around you. So if there's anything you think is of value, let me know and I can make things, change things. I can move things around so that it's something that would be of total value to you. So at the moment, the way I've sort of thought about organizing it is that every month we'll have a different theme. We'll talk about one pillar per month. So and I'll tell you a little bit about what those pillars are now. So basically, as I said to you, I'm a specialist in lifestyle medicine. So, and the six pillars of lifestyle are diet, exercise, having good mental health, avoiding harmful substances, getting nourishing sleep, and having good relationships which are healthy. So, and what the evidence shows that if you can improve these six areas, then you can improve your health. And the one we're going to concentrate today is on diet, and we'll talk about that later. But it's all very well knowing what you need to do, then the other thing is I think a lot of us know what we're meant to be doing, but the thing is how do you do that? How do you change your lifestyle? And that's where the coaching comes into it. So it's sort of helping people change the way their mindset, the way they think about things. Okay, so so okay, so I've told you about where um so what we're going to do, that's a rough idea of what we've got to do. So basically one important the important thing for men to do is to know exactly where they are with their health. So because how do you know what you're going to change if you don't really know where you are with your health? So there are numbers which are really important to know. So you need to know what your blood pressure is. You need to know what your blood fat levels are. You need to know what your blood sugar is. And also really important is need to know what your weight is and especially what your waist circumference is. And I will just run through those numbers with you now. Um, so your ideal blood pressure is 120 over 80. It's important to try and get your cholesterol below 5 and specifically your LDL cholesterol below 3 and get your triglycerides below 1.7. It's in your waist circumference. We need to try and get it under 74 centimeters for a white man or of British origin. And below 90 for men of Asian ethnicity because their cardiovascular disease occurs at much lower levels for Asian men. It's important to have your blood sugar below 42, but that isn't a black and white number. So if your blood sugars were 40, 41, you'd be thinking that you need to they're going in the wrong direction. You want to, it's not an exact cutoff. You basically need to try and get your blood sugars down below 42. But if they're 40, 41, we need to sort of try and get them down a bit more to avoid going into those diabetic ranges. Okay, so and if you want that information, I can send that to you afterwards. Just let me know, and I can send you that. I can send you a copy of this presentation, so you and a copy of these slides. Okay, so it's important knowing your numbers, but it's important to know also where you're at with your lifestyle. So I've told you about the 6 pillars of lifestyle. So what I tend to do with men when I first meet them when we do our men's MOT is that we go through what I call is this wheel of life. So, and we go through each pillar and reflect on where someone might be at the moment. So what I would do is maybe invite you to do that now, so that if we go through each of these segments, just give yourself a score between 0 and 10. So for example, let's start with diet. So if your diet was the worst it could possibly be, give yourself a 0. If it's the best it could possibly be, give yourself a 10 and see where you are with your diet. And then do the same with your exercise. So what would you give yourself a score for exercise between 1 and 10, where 1 is the worst and 10 is the best it could be? And the same for mental health. Where are you right now? What are your stress levels? How's your anxiety? How are you feeling with your mood? Also, harmful substances. So when we talk about harmful substances, we're talking about smoking, drinking alcohol, taking cocaine, other harmful substances, pornography, gambling, phone addiction. Any of the addictions come under this category of harmful substances. So give yourself a score from 1 to 10 for that one. And nourishing sleep. So how are you feeling when you wake up? Do you feel refreshed after you've had a night's sleep? How many hours sleep are you getting? Do you think that your sleep could improve? Do you think you might have obstructive sleep apnea? And that's something we'll talk about a bit later. And then look at your relationships. So there's lots of evidence to show that loneliness or not having healthy relationships is directly related to your health. So that is important. So give you a score for that as well. absolutely. And the thing about all of these pillars, that they're all so, like you just alluded to, they're all very closely linked. So, for example, if you don't sleep well, then you might not feel like doing exercise and you might not feel like eating healthily. And you might be irritable, and that might start showing up in your relationship. So you're absolutely right that all of these pillars are all absolutely interlinked. So when you make changes in one, they'll impact all the others. So the pillar we're talking about today is diet or diet nutrition. And so what we're going to focus on today is obesity. So it's a very common problem. As you can see from the number here, 26.8% of people in the UK are now living with obesity. For men, 68% of men are either overweight or living with overweight or obesity. So it's very, very common. I don't know why there's any stigma around weight and weight issues because most of the population are overweight, or most of the male populations are overweight or obese. So it's nothing to be shy about. And the thing with men is that only 11% of men will go to a commercial weight loss program. And interestingly, only 10% of men will get referred by their GP for weight loss, for help with weight loss. So it occurs mostly in men, but unfortunately, they're not the ones who are getting the help for it, which is not right. Um, why is it so important? As we said, it's not what you look like, that doesn't matter. It's about your health. And living with obesity can affect every area of your health. So it can affect your brain, anxiety, depression. It can affect your heart with increased risk of heart disease and high blood pressure. You can get fatty liver, skin problems, chronic kidney diseases, increased risk of that with obesity. There are musculoskeletal problems like your problems with your knees and your hips and your back and gout. Sleep apnea is more occurs more in men who are living with obesity, type 2 diabetes, immune. It increases your risk of 12 to 13 types of different cancers, especially relevant to men would be like prostate bowel cancer. And also it can have effects on your hormones. So we'll talk just now specifically about how obesity affects men because that's what that's what you're interested in. So basically, the the more obese you are, the lower your testosterone. Because what happens is that testosterone gets converted to estrogen in the fat tissue, and low testosterone can affect your energy, your drive, your mood, so that they're all very interlinked. So obesity can increase your risk of sleep apnea, and obstructive sleep apnea is very common. It's very underdiagnosed, but it is also very important. There's lots of evidence to show that obstructive sleep apnea reduces your quality of life. It increases your risk of depression. It's related to high blood pressure, diabetes, chronic kidney disease, urinary problems. It's related to erectile dysfunction and cognitive problems like brain fog, etc. So it's really important if you suspect you might have sleep apnea to to have that diagnosed and then to have treatment for it. Obesity affects your PSA levels, so it can make them look abnormally low. So it can sometimes mask problems because your PSA could be actually higher than it's being masked by it's sort of like a dilutional effect with obesity. Um, Obesity can, as we say, affect your sexual function. It's related to, so the more obese you are, the more risk you have of erectile dysfunction. And sometimes erectile dysfunction can be the first warning sign of heart problems. So if you have any problems like that, you should get it checked out, find out what your numbers are, have an assessment of your cardiovascular risk. It can affect your waterworks. It can also affect fertility. Okay, so